Hello, good afternoon everyone. I am Dr. Das from Freeport Medical Center. I'd like to welcome everyone to my live video presentation this afternoon, coming courtesy Freeport Medical Center and our educational program that we started earlier this year from February as one of the elements of celebrating our 10th year anniversary. Freeport Medical Center has celebrated its 10th year anniversary this year in February, and we are really pleased to share some of our knowledge and information in the medical field to all our patients and all our followers on Facebook. So I'd like to welcome all our friends on Facebook, including some of our patients, some of our friends who are within Trinidad, and also some of our friends who are outside Trinidad, including patients from North America, Canada, New York, etc. Our last presentation started off with discussion on arthritis, which I started last Monday, and this presentation today is a continuation of that discussion, in which I explained to you all some of the aspects of osteoarthritis. Today I am going to discuss rheumatoid arthritis, and I will also be discussing gout, which is another form of arthritis. So before I go directly into my presentation, I would like to wish all the mothers yesterday. I hope that it was a great day for you all. I know yesterday was Mother's Day. I hope all the mothers of our country and all our mothers who are looking on, and all our mothers from Facebook, including our patients, that you all had a great and enjoyable day yesterday on Mother's Day. Just to recap osteoarthritis briefly, it is a very common condition which affects patients as we grow older. It's a condition which we refer to as a progressive disease, and as you grow older, the disease becomes progressively worse. It affects patients mostly from 40 and upwards, and it affects mostly the joints that takes the weight of your body. So osteoarthritis would affect mostly the weight-bearing joints, including the hips, the knees, the ankles, the spine, and also it can affect the spine, including the neck, spine, and the lower back. But it can also affect the shoulders, the elbows, and the wrist. Those are the main joints that osteoarthritis affects. It's a disease that affects the cartilage of the joints, which we refer to commonly as wear and tear. And as the cartilage gets damaged, the damage spread into the surface of the bones and cause bone sclerosis. These symptoms can be seen simply with an X-ray, and doctors would be able to diagnose osteoarthritis with an X-ray. All right. It's a disease which has very little cure in terms of medication. So once a patient is diagnosed with osteoarthritis, the doctor would try to get the patient to drop their weight, start exercising, and would use some pain relieving medication to relieve the pain and inflammation. Other than that, as the arthritis progressive and it gets worse, some of the joints in the body, you can do replacement surgery, joint replacement, for example the hips, the knees, and in some countries you can also do shoulder replacement therapy. Okay, so that's briefly some of the aspects of osteoarthritis. Today I would like to focus on rheumatoid arthritis first. And rheumatoid arthritis is a very it's a common condition, but it is a more debilitating type of arthritis, in that it progresses very rapidly and can cause joint deformities, causing patients to have sometimes a very low or poor standard of life as the disease progresses. In the medical journals, it is defined as an autoimmune condition that affects particularly the small joints of your body. So rheumatoid arthritis, as opposed to osteo, which affects the weight-bearing and big joints, rheumatoid will affect the small joints of the body. So rheumatoid arthritis will generally start off at about, generally in your 40s and 50s, and it will affect females more than males at about a ratio of 3:1. It affects particularly the small joints, so it will affect. It starts off generally in the joints of your hands, including the metacarpal phalangeal joints. That would be the joint between the palm of your hand and your fingers, and then it progresses to the interphalangeal joints, including the proximal and distal interphalangeal joints. The arthritis in some patients can spread to the wrist, to the heel sometimes, and then also not so common, it can also affect your elbows and your other big joints like the knees, etc. But it's particularly a disease of the small joints. When a patient is diagnosed with rheumatoid arthritis, the disease generally would start off with causing inflammation of the joint. So patients will usually present with stiffness of the joint, which would usually be in the morning. So the stiffness would usually be after resting, and that stiffness will progress to cause pain. So generally speaking, it's a disease that starts off slowly, as opposed to I'm comparing this now with gout, although I didn't speak about gout. Gout is a disease that starts off rapidly. So that's how we can differentiate gout from rheumatoid from osteoarthritis. So there are those three different types. Osteoarthritis, the pain is there constantly throughout the day. Rheumatoid arthritis, it starts off gradually. So you go to bed, you're okay, you get up in the morning, you have the pain, and then as you start moving off, the pain starts relieving, and then it can eventually go away if it's early. And whereas gout, you go to bed with no pain, and you get up with very strong excruciating pain in your joint. So that's the differential between the three different types. All right. It's a condition that affects quite a lot of people. So in the American Academy, it has been the epidemiological data states that there are approximately 90 million people with rheumatoid arthritis. 90 million. So it's a bit common, and it can spread to other parts of your body apart from the joints. So therefore, because it affects other body parts, patients can meet their demise from complications of the disease. And it has been stated as well that about 50,000 people would die from rheumatoid arthritis per year. Okay. As I said before, it's more common in females than in males at a ratio of 3:1. Okay, so that's the epidemiology. In terms of the cause of the disease, as I mentioned, it's an autoimmune disease, and the pathology is that the disease starts off in the synovial joints and the synovial covering of the joint. So autoimmune means that the immune system, your own immune system, start producing antibodies and cells that are attacking the synovial covering of the joint. Firstly, the joint becomes inflamed, And as the joints become inflamed, the patient will start getting the stiffness and the pain. As the disease progresses and the immune response becomes stronger, the synovial covering will get tattered and damaged, and as it gets damaged, the patients start having stronger pain. This can cause the synovial fluid to change its texture and also to become not effective in lubricating the joint. As a result of that, the covering of the joint also gets damaged. And once this becomes damaged, the patient will then produce more features, including swelling of the joints. So you have what we call topy formation of the joints, which are commonly known as rheumatoid nodules. So you get rheumatoid nodules in the metacarpal phalangeal joints, the interphalangeal joints, and you also see them commonly on the elbows and the wrists. So you form topy on the joints. This, because the joints become damaged because of the inflammation taking place and the immune reaction, there is ulnar deviation of the wrists. So the patient's wrists become bent. Okay, and of course patients have extreme pain at that point in time. Alright, the immune reaction takes place involving both a cellular type of reaction as well as a hormonal or humoral type of reaction involving antibodies. And so the body starts producing antibodies to the synovial covering, and that is referred to as rheumatoid factor. So you have rheumatoid factor in the blood circulating, and then you also have antibodies to other areas in the joints as well. All right. In the pathology, the body produces different types of cells, including macrophages, monocytes, and chemicals like cytokines, interleukins, and there is a particular type of cell known as lymphocytes, T and B type lymphocytes, and also antibodies to the synovial joints. So a lot of medical terminologies here, but it's just to explain some of the aspects of the area of the rheumatoid arthritis and how it really progresses. So therefore, patient present to the doctor. Usually I would see the patient with swollen joints. The joints sometimes has fever. The color changes and it becomes reddened, as well as the joints. A lot of times when the patient comes when the disease has progressed over many years, the patient may have deformed joints as well. Okay, there's immobility sometimes of the joints, and if you try to move it, is very, very, very tender. So the patients bawl in pain, they scream out with pain. All right, and the joints, you can see the skin is become thin over the joints because of the swelling and the pain, and you could also see the topy formation at the joints as well, rheumatoid nodules. All right, so that will be how the patient comes to you, but the patient also have general signs of inflammation, for example tiredness, a bit of malaise, may have fever, anorexia, difficulty, they don't want to eat at all. Some patients lose weight, they become anemic as well. All right, and patients generally want to rest. It's very difficult for them. All right, I'd like to say hello to some of our Facebook friends who are logging on here. Jeffrey is there, Mel and Jeffrey again. Jeffrey Phillips is asking, Doc, can you tell about kidney? Is feeling pressure always high, a lot of pain? Okay, this question does not pertain to rheumatoid, but I'll quickly say yes. If you have high blood pressure, yes, it can affect your kidney, and high blood pressure is one of the causes of kidney failure. If it's over a long period of time, uncontrolled high blood pressure can affect your kidney, definitely. All right. Okay, very well. So that's how the patient presents. So patients could also have, apart from the joints, they can have symptoms in other parts of the body. And for example, patients may have they may have skin symptoms known as rheumatoid nodules on the skin. The skin may become very thin, and sometimes patients may have palmar erythema, where the hands become reddened. Palmar erythema as well too. Okay, if to start, just mention quickly other areas of the body. It can affect the eyes. Rheumatoid can also cause blurry vision due to damage to the connective tissues, and you can also have from the sclera of the eyes. You can have inflammation of the sclera. That's a covering of the eye, causing opacification of a light passing through the eye, causing a decreased visual acuity. All right. Then you can have effects to the lungs. Patient may have fibrosis of the lungs due to inflammation taking place there, and the immune reaction as well. You may have kidney amyloidosis taking place, causing kidney failure. In the heart, if the patient has other risk factors, patient may develop coronary artery disease, and patient could develop angina, and therefore other forms of heart problems. Right? Kidney, liver, yes. So, and in the bone, it also affects the bone. There is activation of osteoclast activity, and patient can generally develop osteoporosis at an earlier age as well with rheumatoid arthritis. So there are quite a lot of other organs that are affected with rheumatoid arthritis. All right. Rheumatoid arthritis, how do you diagnose it? Well, as soon as the patient thinks that they have rheumatoid arthritis, they visit the doctor. He will examine you, and all the features of the joint, as I just explained, the doctor will be looking for those. In addition to that, he will do what we call a blood test for the rheumatoid factor. You remember I mentioned that the immune reaction produces antibodies, and you can check for the antibodies known as rheumatoid factor. You can also check for CCP, which is a protein that is produced in rheumatoid arthritis. So we check for CCP. CCP is more specific, whereas rheumatoid arthritis is rheumatoid factor is not as specific, because you can get rheumatoid factor from other conditions, but CCP is more specific for rheumatoid. As well as sometimes you may have seronegative patients. So a patient may have rheumatoid factor but do not have the rheumatoid arthritis, but do not have the rheumatoid factor. So it's important that you do the CCP as well as the rheumatoid factor, right? You can do other blood tests as well. The doctor will prescribe a full blood analysis to check for anemia, to check the iron in your blood. He will also check the ferritin levels. You will check the kidney function, the liver function. You will check the acid in your blood. You will check the other than that, you will also check liver, kidney. Yes. So, and you check the uric acid as well too. All right, and you complete blood analysis. And very importantly, I was trying to get this. You will also check for the inflammation indicators in your blood, including C-reactive protein and ESR. Those are the things that you must check as well too. Okay. Asha Mahadev is also logging. Hi doctor, can you treat early symptoms of rheumatoid? Definitely, Asha. I'm going to go into the treatment now, so you will hear some of the aspects of treatment. But we definitely treat. I do have quite a lot of patients with rheumatoid who I treat. Yes. Gail Ann is asking. Thank Gail Ann for your nice comment. She's saying that we're doing a good work. Alright, so once a patient has been diagnosed with rheumatoid arthritis, again as well, just to mention quickly, I'm trying to speed up now, that you must do x-rays as well for rheumatoid arthritis. How do you treat this patient? Well, a patient with rheumatoid arthritis, there are new drugs in the market known as disease-modifying rheumatoid arthritis medication, right? And This will include medication that will slow down the process. So it is important to know that we not only will, like in osteo, where you will give pain relievers and try to treat the patient by relieving the symptoms. In rheumatoid, we try to slow down the inflammation and the autoimmune reaction. So these are called disease-modifying drugs. These should be used. You have to go to a doctor who knows about treating these problems. These problems are treated right by us at Freeport Medical Center. So you use the disease-modifying drugs to slow down the process. Then you also have some new drugs known as biological drugs to use to treat rheumatoid arthritis, which will not only slow down the process but also help to relieve the symptoms as well too. Alright, so those are two new drugs on the market that can be used. I obviously, because of medical confidentiality laws, I cannot mention names, but I can definitely mention the group of drugs. In addition to that, because of the inflammation taking place in the joints, patients can be given anti-inflammatory drugs. They can be given non-steroidal anti-inflammatory as well as COX-2 inhibitors drugs for the pain. Alright, patients can also use steroids as well too, as well as you can also use other forms of pain relieving medication. Alright, in addition to that, again, patients will have to exercise, strengthen their joints. Patients will also need to do therapy as well to get back the movement of their joints. Alright, some literature has recommended joint replacement in cases where patients have so much damage that the joint needs to be replaced, like hip replacement, knee replacement, etc. can be used. So to treat rheumatoid arthritis, it's a long process. Usually you will put the patient on medication and monitor them, because some of these tablets may have side effects, so you have to monitor them using blood tests, as well as the medication takes up a period of time to work, so you don't make a judgment very quickly. Patients are kept on medication for at least at least not 1 year, but at least 3 to 6 months before you can make an assessment as to how the treatment is progressing. All right. So other than that, the prognosis of a patient with rheumatoid arthritis is really poor, generally speaking, because it affects other organs, and you need to make sure and check your kidney, check your eyes. You need to check all the other organs to see if there are effects of these organs as well too. Okay, so it's generally a poor disease once you have rheumatoid arthritis. All right, I like to so that's basically what I like to say about rheumatoid arthritis today. But I like to quickly, in my last few minutes, to mention and to speak a bit about gouty arthritis, or gout. Now, gout is another common kind of arthritis. It affects about 60 million people worldwide. It is an arthritis caused by has a specific cause for this type of arthritis, and usually the patient will come to me with swelling of their toes or the heel, swelling of the toes or the heel, or the foot generally. It specifically affects the metacarpal phalangeal joint of the big toe. That's the main joint that it affects. And the patient would say that they either had alcohol to drink the night before, or they had a lot of heavy meats to eat, and they went to bed with no pain at all, but get up in the morning with very severe pain. In fact, they couldn't get out of the bed. Gouty arthritis, its etiology is that of high levels of uric acid in the blood, which uric acid tends to form crystals, and as the crystals form, uric acid crystallizes. It has a predilection to go to these joints. It goes to these joints and it causes inflammation and extreme pain. So the joint is swollen, it is very painful, it has fever, and patients are unable to move the joint. Okay. The patients who get these are usually patients who eat a lot of heavy meats in their diet and fish, as well as patients who drink beer and alcohol, and and they don't exercise. So you have those patients who would usually get gouty arthritis. It usually affects, it's easy to diagnose because, as you heard, it's a condition caused by acid in their blood. So once a patient comes to us with this problem, we would find out if, as well, in interview them, if there's a family history of gouty arthritis, because it can has a genetic predisposition, as well as it affects males. So most arthritis affect females more, but this one affects males in a ratio of 2 to 1. So you will find more males coming in with gouty arthritis. Right? So we will then examine the patient, and the patient has extreme pain, so we want to give the patient some pain relieving medication right away. So you may give steroidal and injections, or we could give non-steroidal injections for the pain. And once the pain is relieved, we would immediately do some tests. These tests will include collecting some fluid from the synovial fluid from the joint itself. So we may aspirate. We will then try to extract some synovial fluid from the joint and send this fluid to the lab to check for the uric acid levels in the blood. Okay, and once that is done, a diagnosis can be made easily. The uric acid, that will be in the synovial fluid, but in the blood we will also check for the uric acid, as well as we do other tests as well, including the kidney test, full blood analysis, again the C-reactive protein, ESR, and the liver test as well is done. Once these tests are done, patients are treated. First, if a patient has an attack of gout, you first have to relieve the pain, and we can put the patient on synovial, we can put the patient on pain relieving medication to relieve the pain, and once the pain is relieved, we will then put the patient on medication to reduce the level of acid in the blood. Now, acid builds up in the blood for two reasons. One, either you are not passing out the acid fast enough by your kidney, so there's a build-up. If the kidney is moving too slowly to get rid of the acid, there's a build-up in the blood. That's a build-up in the blood, and that accounts for most of the patients. It has been said that 90% of the patient is due to under-secretion by the kidney, or if you're producing too much acid too fast that the kidney is unable to get rid of it. So the kidney is working well, but you are producing too much, right? So that only accounts for 10% of cases. Okay, and so therefore then what we do is, once the pain is relieved, we put the patient on medication that can help the kidney to secrete the acid out of the blood. Okay, so, and there are different types of tablets that we can use to secrete the acid out of the blood. Alright, so I would like to let you know that once this is treated, patients are kept on these tablets for a long period of time, and regular tests are done for the uric acid in the blood to check and see what levels. We usually like the acid level to be below 7 milligrams per deciliter. Sometimes, if not sometimes, but the majority of cases when patient has an attack of gout, it is above 7. So you keep the patient below 7, and then we try to change their dietary habits by letting them cut down on their meat and of course beer and drinking alcohol, etc. Alright, patients are also asked to exercise, to strengthen their joints, and to drink lots of water. Keep away from acidic food and drinks, as well as the heavy meats, etc. All right. It, in terms of gout, we have to make sure that it's not not um, uh, confused with other forms of arthritis, like infective type of arthritis. We also have to check and make sure that it's not rheumatoid or lupus, as the case may be, lupus arthritis or psoriatic arthritis. So there are quite a lot of different types of secondary arthritis that you also have to be aware of as a doctor, looking out for, to ensure that you don't confuse the diagnosis with other types of arthritis. Alright, so generally that's it in a nutshell for gouty arthritis. We would also like to mention here that it can cause stones in the kidney as well, so patients will have to have an ultrasound and an x-ray of the kidney, and you'll also have to check if the patient has stones, check for the calcium level in the blood, the magnesium, the oxalate levels, the chloride levels, etc., to ensure that it's not a calcium stone rather than an oxalate stone or uric acid stone. Alright, so I would like to just wrap up here now and let you all know that arthritis is extremely common. If you combine all three, osteoarthritis, rheumatoid and gout, it's a very common condition, and osteoarthritis, of course, is the most common one, but rheumatoid and gouty arthritis is also very common as well too, and it's becoming more common because of people's diet and lifestyle, etc. Alright, as I wrap up, I like to thank everyone for logging on and looking on at our live video. I was very excited for this video today because I know I started it last week, and you know, it's a continuation of our discussion on arthritis, and I know it's very common because I see quite a lot of patients with arthritis, and I treat all forms of arthritis, including gout, rheumatoid and osteoarthritis. We also have our x-ray facilities here where we do all our x-rays for patients who comes in. We also have our CT scan service, which we also use at very often. Patients come in with different problems, and we have to utilize the CT scan services and the blood test services. So all the investigative measures that patients need are available at Freeport Medical Center. And just as I'm about to wrap up, I'd like to remind everyone of our specials on CT scan. I was mentioned to you last time that we are really considered now to be the CT scan specialists in Trinidad and Tobago, where we are giving quite competitive pricing to all our patients who need CT scan, and patients are taking advantage of that because CT scan is not available throughout the country, and the prices are extremely high at other places. At Freeport Medical Center, our prices are very, very competitive. Alright, next week Monday I will not be doing a live video because I will not be available. I will be attending a conference, so I will not be available next week Monday, but I will be on the following Monday, which will be the 29th of May, and we will be discussing the topic. We haven't decided on which topic as yet, so we will post up the topic sometime next week to let you all know what topic we will be discussing. Alright, thanks everyone for logging on and looking on, and please enjoy your week, and I will see you on the next video. Thanks everyone. Bye bye.